dose by an unintended route can be fatal. Section 5 contains storage conditions. Storage instructions can be put on the primary label or added as an auxiliary label. Finally, Section 6 provides other information for safe use. Other information, including cautionary statements for the safe use of the preparation, can be put on the primary label or added as an auxiliary label. This information should include the initials of the pharmacist who prepared or checked the preparation and complete directions for the proper clinical administration, including device-specific settings and instructions. In addition, hazardous drugs should have appropriate precautionary labels to facilitate safe handling, use, and disposal. For facilities that ship preparations outside their own facility, disposal instructions for out-of-date or unused units should be included. Next, let's look at patient-specific labeling. In addition to these minimum labeling standards, patient-specific compounded sterile preparations have additional requirements when used in institutional and/or home care settings. Accurate labels not only help staff efficiently deliver preparations, but also supply needed information to staff or patients and caregivers to safely administer the correct medication to the patient. Section 1 includes the patient name and identification number. A patient name on a label defines the dose as ordered for the patient. Exclusion of a name can lead to errors. Identify both the first and last names of the patient, and ideally, a middle initial. In addition to the patient name, a medical record number or account number also identifies each patient in most hospital computer systems and can serve as a second unique identifier. This number is especially critical to drug administration in hospitals that use barcode technology. Section 2 displays the patient location. A patient's location information within a treatment facility ensures that the drug gets to the correct patient. Transfer or discharge of a patient also should be tracked so that the label information is updated. Without accurate location information, delays in therapy and unnecessary work can result. Section 3 shows the name and amounts of drugs added and the name of admixture solution. This section is similar to Item 1 on the USP label. However, it includes the names and amounts or concentrations of the drugs added to the compounded sterile preparation, as well as the name of the admixture solution used in compounding the sterile preparation. Identification of the admixture solution makes the label more complete and accurate. Section 4 gives the approximate final total volume of admixture solution. This section is the same as Section 2 on the USP label. The total volume should be listed for all preparations, including intermittent and continuous IV admixtures, critical care infusions, total parenteral nutritional fluids, irrigations, dialysate fluids, and small volume sterile preparations, such as syringes. Section 5 shows the time and date of scheduled administration. In institutions, the scheduled administration time is generally referred to as the due time and is expressed in military time. This information notifies the nursing staff of the administration schedule maintained in the pharmacy. When admixtures are in an improper sequence, the oldest one, that is, the one with the earliest expiration, may not be administered, which creates waste. Institution-specific standardized administration times also reduce the confusion and prevent omitted doses. Section 6 includes the time and date of compounding. The time and date of compounding are needed to determine actual beyond use times for recycling preparations. In addition, JCAHO requires the prepared date for all compounded IV admixtures and parenteral nutrition solutions. JCAHO also requires beyond use time for all preparations with beyond use periods less than 24 hours. This information may be contained on the label, even if it is not stated clearly. For example, the scheduled administration time may indicate when a drug was prepared based on that sterile preparations batch or fill list period. Section 7 includes beyond use date and time, if applicable. This section is similar to Section 3 on the USP label. Traditionally, in an institutional setting, the expiration or beyond use date assigned to a preparation is the actual time that the medication is considered unusable by the patient. The beyond use date might also be a standard amount of time in which the medication should be returned to the pharmacy. After it's returned, the pharmacist can determine if the preparation should be recycled or discarded. For compounded sterile preparations with beyond use periods less than 24 hours, a beyond use time is also required. Section 8 shows the route of administration. This section is the same as Section 4 on the USP label. Section 9 gives administration instructions. This section is similar to Section 6 on the USP label. However, it includes all directions needed for proper clinical administration of the preparation in an institutional setting. For intermittent doses, include administration instructions with the duration and rate of administration. If the preparation requires activation or some other manipulation prior to patient administration, this information should also be included on the primary label or added as an auxiliary label. For continuous infusions, administration instructions generally include the rate and possibly a stop time. The rate should not be included for a continuous infusion if the drug is being titrated, because the rate may change. In these cases, directions such as infuse as directed or titrate may be more appropriate. Now let's talk about the batching process. Batching is the process of preparing multiple drugs that will be needed during a specific period of time. The process is as follows. A setup technician collects drugs, records, labels, and other items that are not stored at individual workstations and will be needed to batch a certain preparation. The collected items are placed in a bin and left on the setup counter, ready for a technician to take to a laminar flow hood workstation to compound. After gowning up in proper cleanroom attire, you will retrieve a bin at the setup counter and proceed directly to a laminar flow hood workstation. To keep the items used for compounding as sterile as possible, you should not leave the workstation until the batching process is completed. With careful estimation, the Minibag Plus and Advantage IVs can be prepared in batches. Accurate estimation is necessary in order to limit waste due to the 30-day expiration that begins as soon as the attached drug is added to the suspension fluid bag. Medications compounded in piggyback IV systems and drip IV containers can be prepared in batches. But depending on the drug used, the processes, labeling guidelines, documentation for records, and expiration dates may be different. We will now discuss auxiliary labeling. Auxiliary labeling provides supplemental instructions and/or precautions similar to Section 6 on the USP label, without the space limitations of pre-formatted or computerized labels. Auxiliary labels have an added advantage of highlighting the information, since the label looks different. Auxiliary labels also can help staff follow the manufacturer's recommendations and/or the pharmacy's guidelines for storage of all medications prior to distribution. The same auxiliary labels should be used each time a particular sterile preparation is dispensed. Otherwise, users may question the importance or validity of the information. Auxiliary labels are often used for information about light protection, final filters, rate precautions, storage conditions, drug concentration, routes of administration, and other information for safe use. All information for the safe use of the preparation is now required as part of the labeling, either on the primary or auxiliary labels. Finally, let's discuss the importance of expiration dates. Expiration dates provide information that alerts pharmacy workers when medication loses its desired strength or potency. Expiration dates differ depending on the drug and the environmental conditions in which they are stored. When the drug is expired, the medication must be taken out of circulation to ensure patient safety. Within the pharmacy, only authorized personnel may label and dispense medications, make labeling changes, or transfer medications to different containers. Patient-specific CSPs have additional requirements for use in institutional and home care settings. Batching is a process to prepare multiple drugs that will be needed during a specific period of time. Use auxiliary labels if additional instructions or precautions are warranted. Expiration dates prevent the use of a medication that has lost its desired strength or potency. Check these dates regularly, since different drugs have different expiration dates. Now that we've completed Section 7, please stop the program and review the chapter on labeling in your workbook. There are several systems for receiving pharmaceuticals depending on where you work. These range from total in-house systems through various autonomous or semi-autonomous procurement agencies to total privatization. Regardless of the type of system used at your facility, there are some general guidelines that must be followed to ensure the safety of all personnel within the facility. In this section, we'll review the proper procedure for safely receiving and storing pharmaceuticals. Some pharmacies have a dedicated purchasing agent to manage the procurement and inventory of pharmaceuticals. Others employ a more general approach, with a variety of staff involved in ordering pharmaceuticals. The state-of-the-art practice involves the use of computer and internet technology to manage the process of purchasing and receiving pharmaceuticals from a drug wholesaler. This technology includes using barcodes and handheld computers for online procurement, purchase order generation, and electronic receiving processes. Using computer technology for these purposes has many benefits, including up-to-the-minute product availability information, comprehensive reporting capabilities, accuracy, and efficiency. It also encourages compliance with various pharmaceutical purchasing contracts. One of the most useful experiences for a new pharmacy technician is to see the pharmacy department receive pharmaceuticals. This experience is useful for a number of reasons. First, you will become familiar with the various processes of ordering and receiving pharmaceuticals. You will also learn the procedures for ordering and receiving formulary items. This ensures that only formulary items are put into inventory. Finally, it will familiarize you with where drugs are stored. Receiving is one of the most important parts of the pharmacy operation. A poorly organized and executed receiving system can put patients at risk and elevate healthcare costs. For example, if the wrong concentration of a product were received in error, it could lead to a delay in therapy or a dosing error. Some pharmacies implement procedures to ensure the person receiving pharmaceuticals is different from the person ordering them. This process is especially important for controlled substances because it effectively establishes a check in the system to minimize potential drug diversion opportunities. In a reliable and efficient receiving system, the receiving personnel verify that the shipment is complete and intact before putting items into inventory or circulation. The receiving process begins with the verification of pharmaceuticals delivered by the shipper. The person receiving the shipment begins the process by verifying that the name and address on the boxes is correct and that the number of boxes matches the shipment manifest. Many drug wholesalers use rigid plastic crates because they protect the contents of each shipment better than foam or cardboard boxes. These crates are also environmentally friendly because they are returned to the wholesaler for cleaning and reuse. Whichever the case, each box should be inspected for gross damage. The shipper is responsible for ensuring a cold storage environment is maintained during shipment and will generally package products with a cold storage requirement in a shippable foam cooler. The foam cooler includes frozen cold packs to keep products at the correct storage temperature during shipment. Products with cold storage requirement should be processed first. If you are responsible for receiving, you play a critical role in protecting the pharmacy from financial responsibility for products damaged in shipment, products not ordered, and products not received. Any obvious damage or other discrepancies with the shipment should be noted on the shipping manifest, and if warranted, the shipment should be refused. Ideally, identifying gross shipment damage or incorrect box counts should be performed in the presence of the delivery person and should be well documented when signing for the order. Other problems identified after delivery personnel have left, such as mispicks, product dating, or internally damaged goods, must be resolved according to the vendor's policies. Most vendors have specific procedures to follow in reporting and resolving these sorts of discrepancies. The next step of the receiving process entails checking the newly delivered products against the receiving copy of the purchase order. This generally occurs after the delivery person has left. If you are responsible for checking products into inventory, use the receiving copy. This ensures that the products ordered have been received. The name, brand, dosage form, size of the package, concentration strength, and quantity of the product must match the purchase order. Once the accuracy of the shipment is confirmed, the purchase order copy is generally signed and dated by the person receiving the shipment. At this point, the product's expiration date should be checked to ensure that it meets the department's minimum expiration date requirement. Frequently, departments will require that products received have a minimum shelf life of 6 months remaining before they expire. It is noteworthy to mention that on occasion, the manufacturer or wholesaler inadvertently may ship an excess quantity of an ordered product to the pharmacy. The ethical response is to notify the manufacturer or wholesaler of this situation immediately and subsequently arrange for the return of any excess quantity. Controlled substances require additional processing on receipt. Regulations specific to Schedule II controlled substances require that a Drug Enforcement Administration Form 222 be completed on receipt of these products and filed separately with a copy of the invoice and packing slip accompanying each shipment. Once the product has been received properly, it must be stored properly. Depending on the size and type of the pharmacy operation, the product may be placed in a bulk central storage area or into the active dispensing areas of the pharmacy. Compare the expiration date of the product with the products currently in stock. Products already in stock that have expired should be removed. Products that will expire in the near future should be highlighted and placed in the front of the shelf or bin. This is a common practice known as stock rotation. The newly acquired products will generally have longer shelf lives and should be placed behind packages that will expire before them. Stock rotation is an important inventory management principle that encourages the use of products before they expire and helps prevent waste and the use of expired products. As a pharmacy technician, you will usually spend more time than pharmacists handling and preparing medications. You will hold the critical responsibility of assessing and evaluating each preparation from both a content and a labeling standpoint. It will be up to you to confirm that the receiving process was performed properly. Just as important as checking the product label when a prescription or medication order is filled, taking care when receiving pharmaceuticals and accurately placing them in their storage locations is essential. You should read product packaging carefully rather than rely on the general appearance of the product, because a product's appearance may change frequently or be similar to other products. Technicians play a vital role in minimizing dispensing errors that may occur because of human fallibility. As a technician, you are generally the first in a series of checks involved in an accurate dispensing process. When performing purchasing or inventory management roles, you must pay close attention to the product's expiration date. For liquids or injectable products, the color and clarity of the items should also be checked for consistency with the product standard. Products with visible particles, an unusual appearance, or a broken seal should be reported to the pharmacist. Because pharmacy technicians handle so many products each day, they are in a perfect position to identify packaging and storage issues that could lead to errors. You should pay close attention to these three main issues. Look-alike or sound-alike products. Stocking products of similar color, shape, and size could result in an error if someone fails to read the label carefully. All staff members should be alerted to look-alike or sound-alike products. Misleading labels. Sometimes the company name or logo is emphasized on the label instead of the drug name, concentration, or strength. Product storage. Storing products that are similar in appearance, adjacent to one another, can lead to serious error. Alerting other staff members to products that fall into one of these categories is essential. Dispensing errors may be averted by simply relocating a look-alike, sound-alike product, or by placing warning notes on the shelf, or directly on the product itself. Pharmacy technicians should also discuss their concerns with coworkers and advocate changes to products with poor labeling. Technicians should also be aware of products that have had a generic alternative recently made available. Technicians that order medications on a regular basis should check for available generics and alert pharmacists to these new products. Some technicians may also work in an area that has over-the-counter products available to customers. When receiving these products, the technician should make sure the label pricing is accurate and conforms to other products on the shelf. Whether ordering, receiving, or storing products, safeguards must be in place to ensure product safety. Any products that are damaged, mislabeled, or expired need to be disposed of properly. Misplaced or out-of-stock products can jeopardize patient care as well as the efficiency of the department. To avoid these unfavorable outcomes, pharmacy technicians should become familiar with the process for receiving and storing pharmaceuticals. We've reached the end of Section 8. Please stop the program and review the workbook chapter on receiving. The goal of an inventory management system is to maintain just the right amount of medicine and supplies in the pharmacy at all times. There are a variety of inventory management systems, ranging from simple to complex. In this section, we'll examine the best practices for maintaining inventory control. The ideal system for inventory management is an automated or computerized system that supports a just-in-time product inventory. Just-in-time inventory management is a philosophy that means products are ordered and delivered at just the right time, when they are needed for patient care, while minimizing labor and cost. This business philosophy marries responsible financial management with clinical aspects of patient care. Another system used for inventory control is a manual inventory system. Running short on a product may affect patient care, and overstocking adds unnecessary expense to the organization. Although automated inventory management modalities are available, manual systems are the most common. Manual inventory systems require the oversight of pharmacy technicians and are usually based on a minimum, maximum, or par level system. Staff may create a pharmaceutical order using a handheld barcode scanning device or enter product stock numbers directly into a personal computer. Manual systems typically involve a minimum, maximum, or par-level shelf sticker that corresponds to each product. The minimum and maximum inventory level is written on this label, and the information is used as a relative guide for pharmacy staff. To avoid running short or overstocking a product, staff members routinely scan inventory levels and maintain inventories within the minimum to maximum range. Now we will compare automated and manual systems. With either the electronic or manual system, you should realize that the diversity of your patient's needs may require modification in a product's par level. In the fully computerized inventory system, each dispensing transaction is subtracted from the perpetual inventory log maintained by a computer. Conversely, all products received are added to the inventory log. When the quantity of a pharmaceutical product in stock reaches a predetermined point, often called par or par level, a purchase order is automatically generated to order more of the product. The technology is available to have a computerized inventory in most pharmacies, but interfacing a computerized inventory system with existing pharmacy systems is often difficult. In addition, other variables, such as product availability, contract changes, and changing use patterns make relying fully on the computerized model impractical. At present, even the most sophisticated electronic or automated systems still require human oversight. The use of automated dispensing devices in inpatient hospital nursing units, clinics, operating rooms, and emergency rooms has facilitated the use of computers for inventory management. Similar devices are evolving in retail pharmacy and hold promise for improving safety, efficiency, and assisting in inventory management. These devices are essentially pharmaceutical vending machines that allow both unit dose and bulk pharmaceuticals to be stocked securely on a given patient care unit location. The Pyxis MedStation, Meditrol, Omnicell, and SureMed are some of the automated dispensing devices available today. The machines are capable of tracking perpetual inventory at the product level. They also prevent access by unauthorized personnel, record the identity of those who access inventory, and how much of a specific drug was removed. A useful feature in many of these systems allows pharmacy personnel to automatically generate a fill list for inventory on the basis of a par-level system. In essence, the nursing and medical personnel who use these automated dispensing devices manage a sophisticated computer inventory and billing system. Medications used to restock these devices may be taken from the pharmacy's main inventory, or a separate purchase order may be executed for each device. The minimum, maximum, or par-level inventory system relies on a predetermined order quantity and an order point, and shelf labels are used to